Falls are the leading cause of injury in adults over the age of 65. 1 out of 4 adults over the age of 65 fall each year, and 3 million are evaluated across our country for falls. Talk to your doctor about your falls, be seen when you have a fall, and work on prevention.
Many people who fall will actually develop a fear of falling. This can lead to them being less mobile or avoiding activities they may have been involved in before. Unfortunately, as we age, becoming less active means we are able to be less active in addition, and it becomes a self-perpetuating problem. This also leads to higher risk for falls. The less that we are mobile, the more likely we are to fall in the future.
So SCL Health has services for patients who've had a fall kind of through our whole continuum of care. So for example, if someone maybe came into the emergency department after a fall at home, they'd probably see me or one of my teammates as a physical therapist there in the emergency department. And we would start with kind of the initial assessment, and we'd come up with a plan. And then let's say we've decided that, you're a little banged up, but you're feeling well enough to go home, maybe with a walker for a short time. We might recommend some home health physical therapy. If you feel like you're doing okay around the house and you'd rather get out and go to the clinic, SCL Health also has outpatient physical therapy clinics. So in terms of frequency of exercise, the CDC, they recommend that everybody, regardless of age, get about 150 minutes of moderate intensity exercise per week.
Many departments or fire departments will offer home safety checks or assessments. So we can come into your home, check for those fall risks, and mitigate those as we're there. On an emergency response mechanism, it's exactly that. It's responding and helping you get the help that you need, and then hopefully the end run is to get you home and back to your normal self again. So there are quite a few things that you can do to make your home safe and make yourself safe inside your home. Some of those items are removing tripping hazards. So removing rugs that don't have any non-slip tread to them or non-slip backing. Watching out for your pets. Providing handrails inside your home. Any grab bars, and just be aware of your surroundings. Things that you can do on a personal level would be make a doctor's appointment and make sure that you're getting into your physician at least once a year. That also includes not just your physician, but also your eye doctor, going to the audiologist, making sure that your meds are up to date and that you're taking the correct ones and the correct doses.
So one of the biggest things that we look at with our elderly patients are medication combinations. And if we see those combinations may line up to cause a patient to become excessively unsteady, drowsy, dizzy, then we're able to screen those orders, call or message a physician or nurse, and make recommendations to something different.
Getting adequate protein every day is essential for building sufficient muscle mass, and that's really going to be your primary support for having better balance, having better support, and giving yourself more cushion if you do suffer a fall. That in addition to just making sure you're eating adequately throughout the day, it can prevent things like low blood pressure, dehydration, other things that can contribute to poor balance or dizziness that could end up resulting in another fall.
So one of the main things that I recommend for community support after a fall is to get either home health or outpatient physical and occupational therapy. If you qualify for home health therapy, I think that's really important because you can have a qualified professional come into your home, make sure you're safe, recommend any adaptive equipment that might be helpful, such as grab bars, elevated toilet seats, walkers, canes, wheelchairs, that sort of thing.
The most important message is that falls are preventable. They're not a normal part of aging. Talk to your doctor about it. It's an important part of preserving your mobility and your independence.